Welcome to Your Health. I'm your host, Rhonda Alfred. For more than 4 decades, Cardiovascular Institute of the South and Terrebonne General Health System have partnered to bring cardiovascular excellence and leading technology to the Bayou region. With a legacy built on expertise, we've pioneered dozens of cardiovascular procedures, devices, and innovations, setting us apart from any other program in the state. Joining us on this episode is Dr. Owen Mogabgab, Interventional Cardiologist at Cardiovascular Institute of the South, who's going to discuss with us today Peripheral Artery Disease and the live case that was performed and telecast at Terrebonne General to the New Horizons Conference in New Orleans. Welcome to the show, Dr. Mogabgab.
Thank you so much.
Well, let's get started with you telling us a little bit more about yourself and your role at CIS.
So I'm an interventional cardiologist. I practice with CIS here in the Houma Thibodaux Bayou region. I've been in practice for about 10 years. I started out at Tulane Medical School and then joined CIS in 2018 and have been here ever since.
CIS is known for having highly talented team of interventional cardiologists, just like yourself. How does the talent of these interventionalists set us apart?
There's 65 cardiologists in our group through Louisiana and Mississippi, and it allows us to really specialize, each of us, on particular aspects of interventional cardiology. I mean, it's pretty well understood if you do something a lot, you get good at it, right? So some of our doctors specialize in valve procedures, some in heart rhythm problems, some in complex heart blockages. And we really, by having different areas of focus and fostering that, we have a lot of different areas of expertise that I think really sets us apart.
You have a special expertise as well, and you performed a live case right here at Terrebonne General, and it was telecast at the new Cardiovascular Horizons Conference. Can you tell us a little bit more about that?
The live case I did was pretty common for being a CIS doctor. It was a patient who had been, we were his fifth opinion, right? He had had multiple open vascular surgeries in an attempt to save his legs, and the surgeries kept failing over and over, and the patient had come to us for a third, fourth opinion, and we were doing a limb salvage case, which is something we commonly do. We're often getting patients from around the region to come here to Houma for that specialized care.
Who attends the conference, and why was it important to show this type of a case?
Dr. Walker had started it with a very strong focus on peripheral vascular interventions, mainly saving limbs. And a lot of the attendees are cardiologists, of course, but it's also vascular surgeons, radiologists, a lot of podiatrists, some primary care doctors, people interested in wound care. But it's always had a vascular focus to it.
So what are some of the major specialized treatments that you provide at CIS and Terrebonne General that people do travel from out of state to receive?
I don't think the patients in this region understand the complexity and expertise that we offer. I would put the skills of our proceduralists up against any medical school, tertiary center anywhere in the country. The complexity of the stuff we do is really impressive, and I don't think the patients in this area really understand that they have that here at home. But we have experts in heart valves, in peripheral vascular intervention, in heart rhythm problems, in complex coronary, that people travel from all over the Southeast and sometimes around the nation to come here to Houma to get. And I think it's neat that we have that here in South Louisiana.
So you mentioned the complex coronary interventions. Can you tell us more, a little briefly, about some of those procedures?
All of us each have our own niche. I perform a procedure called coronary CTO PCI, which is a lot of letters, but basically what it is heart arteries, when they're not 100% blocked, maybe 50 to 95% blocked, can often be fairly straightforward to open. But once an artery gets 100% blocked, it can often be a big challenge. And it takes specialized training and expertise and a very qualified cath lab team like we have here at Terrebonne General to be able to open up these complex blockages. So out of all of our cardiologists, there's a handful of us that focus on this. Here in Houma, myself and Dr. Vinod Nair do a lot of them. And we have patients that travel from all over to come down here. I get referrals from all over the Gulf Coast, North Louisiana, all parts of Mississippi, and bring patients here to Terrebonne. And they have a great experience. The cath lab knows what they're doing, and they provide great care for these patients.
So what kind of impact do you foresee us having in the next 40 years?
40 years ago, if you wouldn't believe it's the same profession 40 years ago, right? Cardiology has changed. It's the fastest growing field in all of medicine. The things that we were doing back then have totally changed. I anticipate the next 40 years probably won't be any different. And the nice part about it is our group and this hospital have always fostered bringing in the next best technology, the newest devices and treatments and therapies on the market so that we can offer that to all of our patients. So I anticipate that as cardiology continues to rapidly evolve and grow, we'll continue to be at the forefront of all that right here in South Louisiana doing it.
Tell us how someone can schedule an appointment with you.
I work in Homa and Gray and Thibodaux and in our clinic in Harvey. But you could go to cardio.com, call any of the clinic numbers, and they'll easily set it up.
Okay, and we'll put that up on the screen.
That'd be great.
Viewers to know. Well, thank you so much for taking time out of your busy schedule to be with us today.
Absolutely. Thank you too.
For more information about the 40-year legacy of cardiovascular care between Terrebonne General Health System and CIS, visit tgncis.com. Thank you for tuning into To Your Health. I'm your host, Rhonda Alfred, and we'll see you right back here next week.